Depression, unfortunately, is incredibly common. Statistically speaking, 1 out of 10 people on Earth has suffered from a depression. So, that's literally billions of people. It's impossible that there aren't lots and lots of men out there, unfortunately, who suffer from depression. And depression can look like different things for different people. For men, it's because men tend to place more emotional value in things like career and financial success. Men are more likely to have a depression that's precipitated by problems with money or career than women are. Men also are more likely to have a depression that's related to childhood sexual abuse or to problems that stem from childhood. And so it's just as important for men as anyone else to seek out care for depression. We're all on an emotional spectrum, and it's normal to feel anxious or sad and even to have days where those things can be problems. What's not normal, and when things become a diagnosis and need to be treated as problems, are when they're really distressing over weeks or months, or they're impairing. People not able to enjoy friends, not able to get stuff done at work, to concentrate well, take care of their families. Those are all, red flags that a diagnosis might be going on. So depression is a cluster of symptoms, either low mood or a problem enjoying things, and then a number of other things, which can be a combination of sleep, energy, appetite, concentration problems, not wanting to be alive or having a plan to hurt or kill oneself, feeling restless or feeling sluggish, feeling guilty or worthless. Those things all go together in different combinations for different people who are feeling depressed. For anxiety, if you want to get into the weeds, there's a lot of different things that are anxiety diagnoses: general anxiety, social anxiety, specific phobias. But the bottom line is they boil down to people being anxious in ways that are distressing and or impairing, getting in the way of function. And they can look like depression sometimes. It's not unusual that depression and anxiety go together. So people who suffer from anxiety can also have problems with sleep, energy, concentration, feeling on edge, nervous, restless. And then they may have specific instances or times when that anxiety is really bad. For example, social situations, or with a specific phobia, it might be going over a bridge or getting your blood drawn. So there are a lot of different ways anxiety can manifest for different people too. If you happen to have a therapist or psychiatrist already, you certainly could start with them, but most people don't. And in that case, your primary care doctor is the best person to start with. They're, it's well within their wheelhouse to assess, diagnose, and treat both depression and anxiety. So it's certainly worth a conversation if you're noticing, a concern for these things, or your family or your friends are noticing a concern. Men should know it's normal, quote unquote, to be depressed. It happens to literally billions of people. 1 out of 10 people on average has suffered from a depression. It's a lot of people. So it's nothing to be ashamed of. It's not a sign of weakness. It's a sign of being a human being. The same way you might have a heart attack or a toothache or sprain your leg, you might get depressed. Both depression and anxiety are treated by both medications and therapy. And there's good evidence for mild and moderate depression, for example. It can respond just as well either to medications or therapy. They're usually best together, but you certainly don't have to combine them. Some people have a preference for therapy. They don't want to take a pill and they feel like they'd rather talk with someone. That's totally legit. There's a lot of different ways to get and do therapy, a lot of different sorts of therapy out there, and a lot of really good ones. On the other hand, sometimes people don't have the time for therapy, or they'd rather take a medication, and Same thing applies. There's a lot of different and a lot of good meds for both anxiety and depression. And happily, the same meds usually treat both. So if someone's suffering from both, it can just be a matter of taking one pill. So a common medication class for both depression and anxiety is SSRIs, selective serotonin reuptake inhibitors, which most people probably have heard of with names like Prozac, fluoxetine, or Zoloft, sertraline. These are effective and safe meds for most people, and they don't always start working right away. It might take a week or two, but within a couple months, they can help make a difference. And someone who's taking an SSRI for depression and anxiety will check in with the prescriber about how it's going, any side effects, if the dose needs to be changed. And these are not medications that need to be taken, lifelong. Usually the guideline is 6 months after a depression gets better. You can start thinking about tapering off the medication for a first depression. There are people who suffer from repeated depressions over the course of a lifetime. That might be a different conversation where the risks versus benefits of continuing on a med might favor longer term therapy. But for a first depression or kind of straightforward anxiety or depression, these are often, time-limited medications. Talk therapy is different from the conversations you might have with anyone else in your life. You can get a lot of good help from other people in your life, but therapy is a situation where a trained professional in a controlled setting that you agree on together in advance does work with you that's been studied and shown to be helpful for certain conditions. And it's amazing to me as a psychiatrist that simply sitting in a room with someone for an hour once a week, for example, can treat illness. It's amazing. We're wired to be social. We're wired to respond to what other people say. There are a lot of different types of therapy out there. Some are more structured than others. Some might have very specific goals. Others might keep it more open-ended. There's no wrong way to do therapy if you and a licensed therapist are meeting together. And anyone who's wondering about that certainly should seek out therapy, make an appointment, and talk about it. A good therapist will explain everything, make people comfortable, make sure they're agreeing to what they're about to pursue, and then work with them, keep checking in with them along the way. There are some sorts of therapy that within 3 months, for example, can have a big impact on anxiety or depression. There's a lot that we can do ourselves to help stave off and treat depression or anxiety for that matter, meaning good regular sleep each night, exercise a few days a week, healthy diet. Practicing mindfulness can be very helpful, especially for anxiety. In other words, spending 10 minutes a day focusing on your breath or relaxing or doing something where you're both non-judgmental and tuned into the moment. All those things are great for men and women who are healthy and want to prevent a depression or who are already suffering from a depression. Mental health is just as important as physical health, and having a mental health problem, suffering from that, can really make it hard to get things done, enjoy life, maintain relationships, and obviously just feel like you're a happy human being. That's not to be undervalued. That's a right and something that everyone should care for in themselves, in enjoying life. And so if mood or anxiety are getting in the way, that's worthy of a discussion.